I'm joined by epidemiologist and cardiologist Dr. Christopher Labos to talk long weekend holiday safety. Thank you so much for joining us.
My pleasure.
With COVID cases, hospitalizations, and deaths continuously on the rise, everyone also seems to know someone who has COVID. If they didn't get it in December during the Omicron wave, they likely are getting it now. Add in the long weekend religious holidays. How can people protect themselves?
I think people just have to be careful. The most important thing is really to keep gathering small. The more people you have around that table, the more likely it's going to be that one of them has COVID. The smaller the gathering is, the less likely it's going to be. That's really the most important factor. And the other thing is, depending on what the weather looks like, we don't know if it's going to cooperate or not, but having a gathering outdoors is always going to be lower risk than having it indoors. And if you have to have it indoors, making sure there's good ventilation. It's really the same stuff we've always talked about before. It's just a matter of actually doing it and remembering to focus on it.
So public health didn't tell people to stop gathering, but they're asking Quebecers to manage their risk. So what exactly does that mean? Are there other steps that they can take to make gathering safer?
No, not really. And that's what was kind of surprising about their recommendation. I mean, if you have a large gathering, that just increases the risk exponentially. It's really got to keep gathering small. The more people you have over, especially if they've come in contact with somebody who has COVID, that's how outbreaks happen. You really have to know who's coming over to your house. And you've got to make sure that they don't have any symptoms. They don't have any contacts with people who have COVID. And again, if you can do it outdoors, better ventilation is what really decreases the risk as well.
They say flu season started late and now we have flu and COVID circulating. What's the difference and how do we monitor for both?
Well, in some sense, they are both respiratory viruses that are spread person to person, so they obey the same rules. One of the reasons why we've had so little flu over the past 2 years is because people were staying home and wearing masks. If people stop staying home and stop wearing masks, well, we're going to get more flu. So you have to remember that there are other viruses out there besides COVID. And if you're sick, even if you test negative on a rapid test, stay home, because if you go somewhere, you'll just infect people with whatever virus you're carrying inside of you.
Public health says the mask mandate will be maintained until at least the end of April. Should we be keeping them beyond May 1st?
For indoor public settings, yes, I think we should. When you have this much community spread of COVID, there is a very high risk of transmission. Now, if things improve, we can reassess, but we have to remember that with COVID and with all respiratory viruses, we spread it by breathing the same air as other people. So if we're going to be in an indoor place where there's not good ventilation, a mask is a very low cost, no risk, effective way to keep you from getting sick.
Thank you so much for joining us, Dr. Labos.
My pleasure. You take care.